Hey there, I'm Dr. Ruth Roberts, your pet's ally. Thanks for coming on today, and I hope to be able to clarify several things. I know there's been a lot of confusion about iPets Ally, and bear with me 2 seconds. There we go. Now I can see your comments. Thanks. So there's been a lot of confusion about iPets Ally, and I'll offer you hopefully what's a little bit more clarity. So some of you have joined, and thank you so much for that. You still have the ability to get 3 months for $1. And what I did, so you can see and understand a little bit better about what iPets Ally is I've sent you an invitation to join the teaching this evening, whether you have joined iPets Ally or not. And if you check your email, you'll see that in there. It's a Zoom link, so we're going to be able to interact live and in person, so to speak. And the goal is for me to be able to teach a little bit more in depth and then offer you more information to help you with your pets. And there is two options. If you know, on the main page I discussed that it's 30 days for $1. For people that are not my current customers and that have not been supporting me. So you all have a different link that offers you 3 months for $1. And if for some reason you grab the wrong link, just let us know, and what we will do is get you fixed up so that you will get the 3 months at no charge. Now, let me just put the link back in here so you will have that for this, for your special offer. And here's the, if I can get this to play, there we go. There's the link that's specific to you guys, my customers, my friends, my clients, the folks that have been supporting me all along. So check that out. And again, if you have not, if you use the wrong link to sign up, let Michael know. And this is his email. And I think we're getting a little bit better handle on the support that you guys need. And Karen, good, I'm glad you grabbed the right link. So again, the support folks I've got on board, Michael, at the email address I just put in, he's going to handle more order fulfillment, you know, getting into the website issues, things of that nature. And then Arjan is the person to speak with about consultation issues, things of that nature. So here's his email address, if I can type. And finally, we have a phone number, and I can't tell you we're going to be able to answer it, you know, and then get back to you, but leave a message. If the gentlemen are able to help you via email, they will do that, so please always include your email. If you're really having a heck of a time, they can actually call you back from this number. So that'll be our support number I've just posted there. So let me answer in specific a couple of questions that I'm getting. So the way, so I think I answered the difference between the 1 month for $1 and 3 months for $1. And then the cancellation policy. It's really simple. If it's not working for you, you're not finding value, email either Michael or Arjan, tell them, you know, this isn't working for you. We would really appreciate it if you'd tell us why, because that way I know what we need to fix and work on and things of that nature. And again, part of this is that I'm trying to find ways to give you information, but in a way that we end up being supported financially. It takes a lot of money to run these websites and all the social media policy and pay people and blah, 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 blah. And so $10 a month, that's $120 a year, is a pretty low cost commitment for the what I think is valuable information and what many of you feel is valuable information. So this is a way for you to help support me support you. It just helps me keep all the balls up in the air, and it's a way to be able to interact with you on a very different basis and teach intensively about a particular topic, and then provide you information you can hang on to use for the future, and that you can find with ease as you go forward. So that's what I've got about iPets Ally. Do you all have any other questions that I haven't answered for you, and that, things are not making sense? I'll just go ahead and post them up here, and I'll kind of launch into some of the questions that we've got here. And so the first one actually is from Karen about bone meal, and she's wanting to know about using bone meal versus calcium citrate, because her pup Dino's been having trouble with crystals in the urine, and like to see how the change would help. So two things about bone meal. One is that I stopped recommending it because we kept having recalls because of heavy metal contamination. So it's not what I recommend at all. And I'll circle back to the question about crystals in a second, Karen, but Sarah Megru had asked about a calcium supplement. And the other thing to remember with calcium is the most absorbable form, I feel, is calcium citrate. And there's tons of them out there. So there's, calcium carbonate, which is what's in Tums. That's perfectly okay. There is several other forms like calcium oxide that are not very absorbable and tend to create diarrhea. And so the other key thing, the product picture that you sent over, Sarah, has vitamin D in it. And we've seen several pet food recalls due to excessive amounts of vitamin D actually creating kidney damage. So that is the other key thing, is making sure that you're getting a calcium supplement that does not have vitamin D. Again, I try not to use bone meal because I feel there is a great risk as far as heavy metal contamination. So some of it gets caught, some of it doesn't. And that's kind of the problem with supplements like that, is there's going to be patches of an issue, and then much of what gets tested is okay. So let's avoid using bone as a ground supplement. Use the bones raw for them to chew on, and that will help keep their teeth cleaned up and all that good stuff. So circling back to Karen's question about crystals, the calcium actually has little to do with the crystal urea, and what really it has to do with is urine pH. And so if you're worried about the calcium source, my guess is that Dino has calcium oxalate crystals, and the issue is urine pH, meaning it's probably too acidic. So there is kind of two types of crystals. One is calcium oxalates. In most of the commercial foods, they have been way over acidified, and so we're looking at urine pHs of something on the order of 5 to 6.5. And at that concentration, or at that pH, you're going to see those calcium oxalate crystals form. Now, the thing that really stinks about that is if they turn into bladder stones, they are not easy to dissolve medically. There's a couple of herbal supplements that have been helpful off and on, but we've also seen some other issues with a couple of the brands, so you do have to be careful. So the other type of crystal that tends to form in the urine is struvite crystals, or triple phosphates if you're old like I am. And those form in alkaline pH. So what do? The trick is that if the urine pH is too high, or what you're going to do is add something to acidify it or lower it. And the way you can find out, you don't have to go to the vet to deal with this. The way you can deal with this at home is to get pH papers, and you can get those on Amazon and all over the place. So, just You don't even have to catch a urine sample. You can drop a little strip of paper on a blade of grass that has urine on it, look at the color change, or just touch enough so that you can hang on to it, look at the color change, and compare it to what's on the little packaging. So goal urine pH is 7 to 7.5, and that's the range in which crystals are unlikely to form. So if your pet's urine is too alkaline, you add a little bit of either methionine, or more simply, you can add vitamin C. And that's, we've got doses here and there, and we've discussed this many, many, many times. But a good starting dose for a 50-pound dog is probably 500 milligrams of vitamin C twice a day. Now, if conversely, the urine pH is too acidic, that's when we add baking soda to bring it back up to that 7 to 7.5 range. The other key thing, yep, there you go, Karen, so that's great to hear. So she said that it was oxalates and this pH was 6.5, and now it's regulated with baking soda. So that's really the trick. The other key thing is that you want to take a urine sample at a consistent time, ideally first urine of the morning, because it's going to change throughout the day based on what your pet's been eating. The other thing I want you to remember is that, particularly with struvite crystals, you take a urine sample into the vet and they send it off to the lab to be checked. So that means that urine sample is sitting in your vet's office and then at the lab for a minimum of 12 hours, let's say. So that's plenty of time for crystals to form in the urine, even if they're actually not present in your pet's bladder. Does that make sense? The other thing with Crockpet Diet is that you can control the urine-specific gravity by adding water. So we want the urine-specific gravity to be pretty dilute, and it actually will scare your vet because they're used to seeing pets having eaten only dry food. So they consider normal urine-specific gravity to be 1045. And what that means, to give you some frame of reference, is the specific gravity of water is 1. So 1010, below that, means that your pet's kidneys may not be able to concentrate urine well. And so that's where they get alarmed, and that's where it's worth looking at, is this really an issue? And that's a whole nother bag of wax. However, when I would shoot for something like 1025 to 1030. And so if your pet has had crystals, if they have more water in the urine or more fluid in the food, they're going to make a larger volume of urine, which is going to make it much more difficult for crystals to precipitate out of the urine and into the bladder and create irritation at minimum and stones at worst. So I hope that is helpful. Let's see. And then Bettina says Murphy's Glacier Peak stress scan came back, and she's asking if she eliminates the foods that came up as him being sensitive to that, doesn't that make his meals unbalanced? And Bettina, this is where you have to look at, okay, what's there, what's sensitive, and this may be where we need to look at doing another consultation so I can help you get things balanced out. But if you stay in those, if you use that template, which is in the file section in this group, and, pick a protein, pick some brassica species vegetables, and then choose some other veggies and then a starch, you can still work with that stress scan and keep it in balance. If you need help with that, that's really where these consultations are super helpful. And if you've done a consultation with me in the past, there's a reduced cost for it going forward to work with, either revisit issues that you're having trouble with, or if you have new pets you want me to work with. And Arjan can help you get that fixed up, but basically the link to add on some consultation time is right here. This does not show up in the store because, again, it's important that we've already worked together and I've done a thorough records review to so that I know what's going on and we're able to kind of start from scratch. So I hope that's helpful. But yeah, use that template as a way to make sure that you're staying in balance. And that brings up another issue, which is recipe creep. And what that means is, and this is where it gets really confusing. But in general, what recipe creep means is that, oh, I've got a bunch of this, so I'll just add that. And to some degree, that's all okay. For instance, we talked with May last week about adding extra, she inadvertently added some extra veggies. Not a big deal. Now, if you go about, just, I'm not going to feed beans, but you don't increase the protein and you don't increase the calories via fat or carbohydrate, then that's going to create some issues. So again, what I'd really strongly encourage you to do is to use that template. And if you've got questions about, okay, my dog can't eat beans, then what do? Go back to those recipes that are available for you, excuse me, in the original Crockpet Diet members area, so that you've got a basic set of bones, so to speak, to really help you stay on task and keep that recipe in balance. So I hope that's helpful. And Noelle is asking about 2 cats. She'd love to get on the Crockpet Diet, but they're not eating it. And yes, and Noelle, if you go to the ebook, and I guess really what we need to do is bust out a starter recipe so it's easily available in the recipe section for cats. But the goal would be to, create something that they're going to really think is groovy. And so for most cats, you would take their favorite protein, and in many cases that's chicken. Use, 3 pounds of that, a cup of butternut squash, and then a cup of kale and some carrots. And then the 6 tablespoons of fat, and then, of course, the calcium to balance it. So I would start with that, and again, with cats, you just have to go slow. So, start with whatever they're eating currently, and literally add a teaspoon of that starter recipe per meal off to the side. So they kind of have to look at it, but they don't necessarily have to dig around it to eat what they want to eat. And then over time, gradually incorporate that into the diet. So that's really the best way to start with kitties. As our kitty Romy, who's now 23, and living with our dear friend Miranda in Charleston, it took me 6 months to convert her from dry food to canned food, and then another 3 months from canned food to cooked food. And then at the age of 18, she's like, I ain't eating any of this no more. And so we ended up having to put her back on dry food and some canned food if she'll eat that, to keep her eating. So it's one of those deals. Cats are tough. At 18, the way I look at it is, actually I guess she's 21 now. But at any rate, at 18, the way I look at it is, she's far surpassed the lifespan of most kitties, and she's very healthy. So if this is what we have to do to keep her happy, that's what we have to do. And then Sarah, I think I got your question answered about the calcium. But yes, the grapeseed oil that you've got there from Whole Foods is perfect. And then this is the best place to communicate with us moving forward. If you've got questions, this is where I can come in once a week and knock them all out, and so that everybody gets things squared away. Because if I were to answer everybody's questions via email, I would never get out of the email box. So this is where, if you've got a quick question about what supplements to use, is this product okay, not okay, put it here, put a picture, and I'll be able to answer it really quickly. Let's see, Sally's asking about supplements that help symmetrical lupoid onychodystrophy. And this, if you're not familiar with this disease, it is an autoimmune disease, and it can really be awful and devastating, because what it does is actually destroy the immune system, destroys cells that grows the nail. And and literally toenails will break off, they'll get pus underneath the toenail. I mean, it's just really not fun for the dog. And so, Sally, the best way to approach this is to look at it as an autoimmune disease, which is, I think Denise mentioned that one of her pups had it and took prednisone for a while and it went away, thankfully. In many cases, this is, it's tough. So that's where really, developing a diet plan and supplement plan for that pet becomes important. But a great place to start is adding in fish oil, probiotics, and then supporting the immune system. And that can be with, various supplements. So things like turkey tail, all sorts of interesting stuff. So that's where I would start with that. Just clean up the diet, take out the super processed carbs, feed lots and lots of veggies, things of that nature. Now, April put up a couple of links. One is a link from Dr. Rob on Protect the Pets on how to order a titer. And I'm not really keen on this because of this. So there's the link. And so the idea is that he's giving you access to titers. Well, the truth is that your veterinarian still has to pull the blood, and he or she still has to send that sample to Kansas State. So, and then your veterinarian has to, so Dr. Rob's going to interpret the test for a fee and that sort of stuff. Folks, just work with your vet. I think this is going to piss a lot of vets off, and rightly so. Essentially, what he is doing is commandeering their job, and granted, there's many of them that don't do their jobs, but talk to your vet. You can help them get an account set up with Kansas State. All they have to do is join the American Holistic ahvma.org, and they can get the same low prices on titers. So, and if your vets have questions, tell them to email me and I'll help them walk through this. A lot of times veterinarians don't get around to vaccine titers simply because they just are overwhelmed and don't take the time to do the research to figure out how to make this work. So, Dr. Rob has been a big proponent of getting real with the rabies vaccine, but I don't think this is an appropriate thing because this cuts out your veterinarian, and you've got to work with these folks. So, help them help you. You can send them, you can do this, and you can, I don't even remember how much Dr. Rob was charging, but you can teach them how to help you and ultimately to help other clients, other pet owners as well. So check that out. We do, if you put a package of information in front of their faces, oftentimes they can deal with that and go from there. So the unfortunate thing is this is the way that most drug reps teach us how to use their products and understand concepts. Unfortunately, most of it is geared towards selling stuff for them, but if we can get a condensed packet of information about what titers are, what they do, how to use them, how to interpret them, then your veterinarian can do all this stuff. But I think it's insulting to say, pay me to interpret the work that your vet's done already. Let's see, and then April is put up a post about Ayurvedic foods, and then actually you put up another one about heating and cooling in traditional Chinese medicine. So the interesting thing is that in Ayurveda, several of the foods are considered to be heating and cooling and vice versa. That's a different subset from traditional Chinese medicine. Now, there is a PDF in the, there's not a separate PDF, but in the ebook there is a list of foods and which ones are heating and cooling and things of that nature. So check that out. She's also asking about what the new jar of Holistic Total Body Support will be, how much it will cost, and when it'll be available. And April, I hope to have answers to all of those questions at the end of the week. The current product actually will be good through January 30th, and it will be available before then. My goal is to produce a much larger size jar, and so this will be a lot easier for you guys to use and hopefully less expensive as well. John is asking about advice for a warm and caring veterinarian in Charleston. So there are a couple of dental specialists. And John, I'm not sure what level of care you need, but you can check out Dr. Sharon Startup. I think she's out of Mount Pleasant, at the Mount Pleasant ER/referral facility. And then Catherine Queck used to be over at the Charleston VRC, although I think Dr. Startup actually has taken her spot in both locations, so I'm not dead sure. Actually, no, I'm wrong. Dr. Startup is associated with veterinary eye care over in Mount Pleasant, so check that out. She's great. Sundog Cap Moon, I did train Dr. Pruitt there. I keep hearing good things, bad things. What I would suggest doing, and a lot of veterinarians in Charleston get really freaked out if you ask them to be there while your pet's having anesthesia. You can ask all those questions, but you need to be prepared to be comfortable for what's going on during anesthesia. So what I would do is ask your friends, sadly, again, I keep making recommendations and then hearing really scary things back. But when I was in practice at Sundog, we routinely anesthetized older pets, and I know that they do still have actually I don't know that. The last I saw, they still had sevoflurane gas, which is much easier for older pets to recover from anesthesia on at Sundog. So check that out. Caroline, who posted kind of a response to you, is still working there, and so she can give you the lowdown if you need some more information. And then lastly, Susan's writing that her dog Abner has lymphangiectasia and recently started having bouts of diarrhea again. And she says his food has not changed, and what can she do for him besides medications? So Susan, there's a couple of things to be cognizant of. One is that if you've been feeding the same ingredients with every batch of food, that actually may be the problem, and now he's developed sensitivity to those ingredients. If that's not the case and you've been rotating and everything has been good, there's a couple of things we can look at. Lymphangiectasia can be a real bear. Again, it's an autoimmune type disease, so if you're not using fish oil or some sort of thing like curcumin to help control inflammation and or probiotics, those are good first steps. And then I think there's a allergy support protocol. Granted, you're not going to need quercetin and nettles, although maybe that's part of it too. It's fall, and in many parts of the country, the fall allergens are cranking up as well. And then lastly, this is where, doing a really thorough review of Abner's medical records, Glacier Peak's Holistic's Life Stress Scan can be helpful to let us know if he has sensitivities to foods or other environmental issues. From that and the medical records, I think we can build you a solid plan to help keep Abner sort of back under control. So, ladies and gentlemen, that's what I have for you this week. I did put a comment in here about being courteous to each other. Miyoshi had asked a valid question about vegetarian diets for dogs, and some of you kind of got a little wound up. Some of you gave her great information. Really, vegetarian diet is not a great deal, but be kind and civil. We all want that kindness and being approached with love and acknowledged for the human beings that we are. We're all trying to do our best, so please stay civil and sweet. This is a place where I just don't, and granted, things are not as bad as they can get elsewhere, but we just don't tolerate flaming because there's just no need for it. So be good to each other, be kind to each other. Many thanks. Until next week, remember your pet's best health starts in the bowl. Until either this evening or next week, take good care of yourselves. Blessings.